Let me hit record real quick. And as we're waiting for it to start recording, I just want to give you folks a heads up. We'll need to cut this short at about 2:55. Please get your questions in as soon as you can. All right, CEO, whenever you're ready, please.
All right, so we are going to be, I guess, wait, Stephanie's here. Okay, so we do have Omicron in the CNMI, and I would like first for Stephanie to provide that report, and then I will make a little comment, a few comments, and then we'll open for questions. Okay, go ahead, Stephanie.
Hi, CEO, and hello, media partners. My apologies if I turn on my camera here. Hopefully that's okay. I think the lighting might not be ideal. Good morning, or sorry, good afternoon, everyone. My name is Stephanie Kern-Allali. I am the Regional Communicable Disease Epidemiologist from our Pacific Island Health Officers Association. I work regionally and have been providing epidemiology support to the CNMI since October of last year. Today I'll be presenting a short COVID-19 in the CNMI update for those here, as well as that I presented yesterday at our Saipan Chamber of Commerce meeting, as well as some other additional information about the Omicron virus. So please bear with me while I go ahead and pull that up right now. All right. Hopefully you guys are able to see my screen. Can someone confirm for me that it's showing?
Yes. Yes.
Yes. Oh, excellent. Thanks so much, Gil. So hello, everyone. Again, this is a short status report and upcoming concerns regarding COVID-19 in the CNMI. We'll go ahead and move forward. So just a general context, this is updated from February 1st. Coronavirus in the United States has been seeing really high case numbers all through January. It's now trending down a little bit over the past couple of week or two, although their testing rate is still high and there are many hospitalizations. Luckily, those trends are on the decline, but as we know from our historical information, those trends in the U.S. tend to happen either in Guam or here in the CNMI a little bit afterwards. So here's that case chart for the United States. This is the yellow line here is showing that increase in cases through the end of December and then a subsequent decrease. Here's Guam. This is that trend I was talking about. See that phase shift as the spike curve has kind of started a little bit later. And in the past, we've seen we're expecting to see a spike for us in the CNMI a little bit later as well. Here's those case rates. This is as of the day before yesterday. As of today or yesterday, we're now on this list up top near Guam. They had a rate of almost 400 cases per 100,000. 2 days ago, CNMI had a case rate of 150. At half that, we are now at the top on this particular chart case rate. We are number 3 on that. This is data from the 31st. We had reported 153 cases. We reported an additional 200 cases yesterday, so we're up to almost 5,300 cases. We continue to see a number of tests, and our hospitalizations are stable at around 8, 9, or 10, and as they have been since around the end of December. Okay, so our cases, our rolling average of new cases as of January 31st, I'm hiding something on the right here, but you can see our general overall trend from when we first identified COVID-19 back in the community cases in late October of 2021. We saw a rise in cases towards the end of November up into December, and that has been trending down for some time. But in the last week or so, you see this on the right, this steady increase, rapid increase in case numbers, and we reported even more yesterday. That has actually changed the axis of this graph. You can see on the y-axis, the maximum was 200. We reported over 200 yesterday, so eclipses the number of cases that we've reported in a single day since the start of this community outbreak. Seeing a rapid increase in cases. Here's our highest point, which was back in December. You can see that same highest point when we had our most cases. We saw we were seeing new admissions a day of about 3 admissions a day. You can see the peak in admissions a day was about 2.5 weeks later in late December. So even though now our census has been stable, like I mentioned, we do expect, as we know, hospitalizations are a lagging indicator of those cases. So as our cases rise, we expect to see those hospitalization admission counts also rise in the coming weeks. In terms of who's getting sick, our age groups that are at risk currently, we're seeing the majority of transmission, our highest rates per population among our younger groups. So our highest case rate in December and January and throughout this outbreak has been our 20 to 49-year-old group, followed by our 0 to 4-year-olds, which makes sense. As you'll see on the next graph, we don't have an FDA-approved vaccine for those individuals, and so they have zero prevention for receiving COVID. And then our next highest rate among our adolescents, our younger folks from 5 to 19. As we know, the vaccination for those 5 to 11 just opened up in November, and folks are still trying to finish off those complete dosage. Their full series of vaccine, which we know is a very safe and effective prevention mechanism for preventing infection as well as severe disease against COVID-19. So those vaccination rates, this is data as of mid-January from our turnkey system, which tracks vaccination data. As you can see, our 0 to 4-year-olds, of course, have no vaccinations. There's no FDA-approved one. We see our vaccination coverage in that lighter sort of mid-blue or fully vaccinated for those individuals who are 5 to 19 is around 72 plus a couple more % from our boosted group. And then our higher age groups have really excellent vaccination coverage. You can also see that we're still lagging behind a little bit on boosters, and we really encourage folks to take advantage of those resources, as we'll see a little bit later. Very effective and important to understand that after completing your full series of vaccination, that immunity does wane, over time. And so they're recommending after you complete a Moderna or Pfizer series, a booster after 4 months, and for those Janssen shots, 2 months, a booster after 2 months. So you can see that our Manamco have a large percentage boosted, 63%, but we're hoping to see that continue to climb. And again, this is data as of mid-January. Those numbers have increased over time. This is our our incidence rate, so the number of cases, new cases in groups, and this is that vaccination coverage again. In mid-January, the second week of this year, the rate of cases, the number of cases in a population was 7 times higher among those unvaccinated than those boosted. We see those boosters and those vaccinations really do reduce the risk of transmission among these groups, and those who remain unvaccinated are really at high risk of getting the virus. And also, as you can see on this graph, is the rate of hospitalizations, number of hospitalizations we see in each group. You can see that they have a 14 times higher in mid-January, 14 times higher rate of hospitalization than those who were boosted. And you can see those vaccines are really, really effective against risk of hospitalization, severe disease, complication, and death, which is excellent. Our goal is to prevent as many severe cases of COVID-19 as possible. Now, status update on Omicron. Omicron variant emerged in December of last year, in November and December of last year, and has quickly taken over the block from Delta, which was the other variant that had been circulating, which is what we saw in our first wave here several months ago, a month ago now. So Omicron has quickly become the new kid on the block. They're at 99.9% of cases in the United States from sequencing results are from Omicron. This is a very efficient variant. It can quickly spread from person to person, much more efficiently than some of the other variants that we've seen. We also know that there are some treatments that are less effective against this virus, and so we're now using different treatments that we do have here on island that are effective against it. And we know that we expect breakthrough infections in people who are fully vaccinated with this from this Omicron variant. But we do know from some of the data I'll be presenting that those vaccines are incredibly effective at preventing severe illness, hospitalizations, and death. So what do we know about this? With this emerging virus, we've seen Omicron get into communities that we haven't seen it get into previously. We saw a huge spike in cases in Palau, for example, which had not seen any cases. They reported 1,000 cases last week. As folks may know, Palau has had a very high vaccination rate for some time. So we are seeing that there is a pretty high potential for transmission, even in highly vaccinated communities, though the good sort of silver lining here is that those vaccines have been proven that they show very few severe cases of that disease. They only have 2 hospitalizations as of data 2 days ago for COVID-19 in their hospital out of 1,000 cases, which is a really, really, really low number, which is great. We have also seen it, some outbreaks start in Samoa and Kiribati, where we hadn't seen severe, large numbers as well. So this variant, is very good at sneaking in. It's very good at spreading, and it can really spread like wildfire in a community, which is a danger for us because although, and we do know it's an Omicron. Omicron is in Guam. They confirmed that as of January 19th of 2022. And Gil, did we mention anything earlier? Did CEO mention anything earlier?
Regarding
Omicron?
not so much, but she's gonna go on soon, right after you.
Okay, well, I'll just tease our media partners here, but we do have evidence that our sequencing results received yesterday, there is evidence of Omicron here on CNMI as well, which is unsurprising considering the spike in cases that we are seeing. We just wanted to share some data regarding case rates and hospitalizations during this Omicron wave. As you can see, this is data from the United States from our CDC partners. You can see a huge spike in cases and an increase in hospital admissions and deaths. And one thing I want to point out here is folks are hearing, you know, Omicron is milder, there's fewer cases of severe disease, which is excellent. We don't want severe cases of disease, but if there are more cases, if it's more easily transmitted, more individuals will get it, and more of those high-risk individuals will become hospitalized. So even though the rate of severe disease is lower, if there are more individuals, the number of individuals who will be hospitalized also increases rapidly, which is a really key metric for us here in the CNMI as we have limited healthcare infrastructure here to deal with more individuals, even if the case rate of severe hospitalization or severe disease is low. As you can see here on this graph from the CDC data, you can see again, like I'm mentioning, here is the U.S. trends when they saw that wave back in December of 2020 and February, really high cases, really high hospitalizations, and then a triple case rate later on with a similar number of hospitalizations. So we are seeing milder illness, but we do know that, you know, the more people who are getting this disease, we will see the more total number of hospitalizations. We also know that vaccinations are all very efficient, and they're still very protective against Omicron, against that transmission, but as well as especially the hospitalization and severe disease. As you can see here, the rates among the unvaccinated really climbed, number of cases among those unvaccinated. So we know that those who haven't completed their booster shot or haven't completed a primary series are at particular risk of infection and severe outcomes. Like I was mentioning earlier, we know that vaccine effectiveness wanes over time. We can see that Omicron is in the red there. And after 6 months after dose 2, our full series of vaccination effectiveness against Omicron infection dropped to 57%. And after that booster shot, it's back up to 90% effectiveness against this disease. So we know we really encourage folks to go ahead and take advantage of those booster doses to bring their protection back online. So some risks of the Omicron variant, I mentioned a couple of these, but getting infected is that first stage in developing severe disease. If you aren't infected, you can't progress into a severe state of disease, so it's really important to control the spread here. We also don't know the impact of long COVID very well, so preventing as many people as possible from that risk is important. We know that increased infections significantly burdens the healthcare systems as the total number of hospitalizations rise, as well as other essential services that are operating since individuals, employees, will have to isolate and have their individuals in their household quarantined. And we also know that the more this virus circulates, the more opportunities it has to change and mutate and come up with new ways to evade systems. So main takeaways, the Omicron surge is coming. We're currently seeing the start of it here. We know that it can still cause hospitalizations and death. This is not a toothless virus. It's still the same COVID-19 disease. We know that out of control spread can overwhelm our healthcare system, so it's really critical to put in place protection measures as well as prevention measures, accessing vaccination, testing, and making good choices, isolating and quarantining yourselves as necessary. Treatments are on island right now to prevent severe disease, including ones effective against this Omicron variant. And we also encourage folks to protect themselves by living COVID safe, as Gil can provide more information about those. But those are kind of the main takeaways here. Thank you so much for the time. I'll go ahead and stop sharing my screen if I can figure out how to do that. But back over to Gil.
Let me just go ahead and jump right in. So, with the confirmation of the Omicron variant in the community, it is essential for the CNMI to ensure individuals are provided the preventive measures to ensure that one can recover from infection of SARS-CoV-2. The case counts and the percent positivity had been our best predictors of COVID-19 burden in our communities in the past. However, we need to monitor even more closely the hospitalizations, as Stephanie had indicated, how medically significant the virus affects our community. We are, again, our goal here is to try to get preventive measures and treatment to individuals. We have the therapeutic treatments, and we are also offering testing. Individuals can find out and prevent the spread by getting tested if they have the symptoms, and isolating and working, and also getting accessing the services that we have, as well as getting your booster shots. There is, as Stephanie indicated, booster or getting the third dose, getting your up-to-date vaccinations is essential to preventing hospitalizations and death. So we'll be basically opening up for questions. Thank you.
Yes, Tomas.
Few questions. I wanted to ask, what was the date of the test sample that was identified as Omicron collected?
I'll go ahead and get this. Yes, hey Tomas, we're gonna go ahead and get that data all in a press release and send it to you folks as soon as possible. We're still looking at the data, but we do know that Omicron is here.
Yeah, because when was the last time you sent tests? Sent samples?
We send samples basically almost daily in reality.
Okay.
Probably maybe twice a week, but it's receiving the sequencing is the issue. So in the last couple of days, we received from December, and probably that's still within the December timeline. I'm just guessing on that one right now, but
Okay.
Gil has said that he's going to confirm that.
Okay.
Yeah,
And,
I think Gil will add this data, but yes, so the timeline is short, December and January samples.
all right. Sorry if I'm in a rush. We were told we have until 2:55. So.
No worries.
And also, can you speak to the CNMI's testing capacity? One thing we've seen, obviously, with the highly transmissible Omicron, that may lead to more people wanting to get tested. How many tests do we have right now? And do we anticipate a surge in testing?
I don't have the inventory for the testing, but we do have, right now we are not experiencing any shortage of testing in regards to PCR. And we may have some issues with antigen testing, but that is because of the manufacturing and ordering them and making sure that it's available. However, but we have the capacity to test.
And let's just say that the testing capacity is tested to the limit. What's your daily limit of testing that you're able to do?
We have, I believe, about 800 per day. Is that what you're asking? And how much we can test per day? Because yeah, I mean, it's really dependent on the staffing as well. But about 800 per day, and then. But then again, we have the kits available. I mean, if we have a threshold that we're monitoring, and if we need to order more, we will definitely get more.
What's the threshold?
Basically, we have at least if we can have at least a couple of thousands at least before we begin ordering some more.
Okay, thank you. That's all the questions I have for now.
Sure.
Any other questions? And I just want to make sure you folks get your questions in. I will be on the meeting right when CEO and Stephanie steps out, but I'll be here to collect those questions. But any other questions? All right, CEO and Stephanie, thank you for your time. I do apologize to our partners for the rush. Again, I'll stay here in this meeting if you folks have any questions. CEO and Stephanie, thank you.
Thank you.